In my previous videos, I told you about different medications that can be used in treating the hair thinning issues. So out of that, the first one I mentioned was Minoxidil. Lot of people use Minoxidil and they don't find results. There is a reason for that, because they don't use it the way it is supposed to be used. So in this video, I'll be telling you regarding how to use Minoxidil, how long it is to be applied, and when to expect the results, and what are the potential side effects that can happen with Minoxidil. Okay. So basically, what is Minoxidil? It is a tablet or a solution, as I mentioned before. It is a potassium channel opener which will help in increasing the thickness of the blood vessels, and it will stimulate a lot of growth factors on the scalp. Now, how to use Minoxidil? Minoxidil, as I told, it comes in an oral formulation and it comes as a solution. Oral formulation is easy. Every morning you'll be taking it after your breakfast. That is not a difficult thing. Now the topical solution, every bottle you purchase, you will get a dropper like this in the bottle. So the most ideal way is to take 1 ml or 1.5 ml of the solution, take a small container, pour that 1 ml or 1.5 ml, dip your right index finger and then apply to the scalp. See, you might notice lot of fancy things like a spray or rest of the things in the box, and that is more easier to apply. But the problem with that is, when you are using a spray, most of the spray will get stuck onto your hair and it will not reach the scalp. This Minoxidil has to reach the scalp to show its maximum benefits. So maybe use this method to find a better result. How frequently do you use it? You are supposed to use it twice in a day. Once in the morning after taking bath and once at night before you go to bed. Lot of people ask me, adanna hachchi amele snana madboda anta keltare. See, what is the point? It is basic common sense. If you apply and then take a bath, then everything gets washed off. So you are supposed to apply that and then you can go to office, not a problem. Ideally, the solution has to stay on your scalp for at least 4 hours. The same thing at night. So just apply and go to bed. The next question people ask is, do I have to wash my hair every day if I am applying Minoxidil? The answer is yes and no. I mean, if you have a shorter hair like me, like all men do, you can wash your hair every day. That is not a problem. But for females, telling the same thing would be difficult. It is difficult for them to wash their hair every day. In that case, what you can do is, today morning they have applied, night just reapply on top of it. Nothing will happen. Again next day morning, just reapply on top of it. It is a medicine which will get absorbed into your scalp. So hagagi, there is no problem even if you apply on the top of the previously applied solution. Next thing, how long to apply this? See, the causes are very different for hair fall, as I mentioned before. So Minoxidil, if it is used as a treatment modality for all those causes, the treatment duration will also vary. Udaharanege, if a male is having male pattern baldness, andre hormone inda avrige baldness aagta ittu anta andre, they have to use it until the hormone is causing damage, which ideally will happen until the person is of 55 or 60 years of age. Correct. So he has to use it until then. If he stops using, maybe 6 months later, he might start noticing thinning of the hair. So have you ever complained that how long should we brush our teeth? No. The reason is, every night we go to bed and there is a lot of bacteria that is getting produced in the mouth, and the next day morning we have to brush. So there is no toothpaste which can give a permanent remedy. Likewise, if the underlying hormonal imbalance is there and it is going to persist for a longer time, then yes, you have to use Minoxidil or anything that is recommended by your dermatologist for a lifetime. Then when to expect the results? Let's say you start using it twice daily like suggested before, and initial 2 months you will usually see lot of hair fall happening. The reason for that is, let us assume that this is a follicle and this is a hair. A hair comes out of a follicle and stays on the follicle for around 5 years. I'm trying to make it very simple, 5 years. After 5 years, it has to fall and again a new hair will appear from the same place. Now, when you start using Minoxidil or other medications, which are basically the hair stimulators that are given by your doctor, the follicle will start getting stimulated and a new hair will start to appear, and this will ideally push the older one. What you notice in the initial 2 months duration is little more hair falling than the previous one. You might think, yaratra hode maraya, modle chanagittu, avratra hodmele innu jaasti beelta ide. Exactly, these are the kind of thoughts that you come across. But actually what's happening is the newer one is pushing the older one. For you to see the newer one really coming up and standing prominent, it takes at least 100 days. So First 100 days, do not have any expectations, just continue to do it very properly, and whatever I'm telling is all based on what the research articles or the medical textbooks or the journals are telling it. It's nothing that I'm telling out of my experience, right? So do it pramanikavagi marta hogi, only after 3 months you will start noticing the change. Next. So if as I told you, iga underlying hormonal causes ittu anta andre, we have to correct the underlying hormonal issue. Like for example, in females, if a female is having PCOD or thyroid problem or iron deficiency, that needs to be corrected as well, or else the treatment will continue to go on and on and on. Imagine you're filling a bucket with water and there is a hole. How long will you fill the bucket? It will be a continuous process. So it is important that we fix the hole as well, so that the process of filling will get over in a shorter duration, or else whatever fill is getting drained out. Simple example. Hagagi, whenever the doctor suggests you to get the hormonal test done, please get it done. The next thing, certain conditions where there is a hormonal nutritional deficiency ittu andre, athwa stress related, telogenephilia, post pregnancy, ee tarad situation alli usually the hair fall will be there for 6 months, and using the treatment for 6 months or maximum 1 year will give a wonderful results. Lot of people, again, they discontinue the treatment abruptly, which is a wrong thing to do. So it has to be always tapered down. Iga daily 2 times use ಮಾಡ್ತಾ ಇದ್ರೆ ಕ್ರಮೇಣವಾಗಿ ದಿನಕ್ಕೆ ಒಂದ್ಸಲ ಯೂಸ್ ಮಾಡೋದು, ನಂತರ ಅದನ್ನ ಸ್ಟಾಪ್ ಮಾಡಬೇಕು. See, your hair is being supported by something called as minoxidil, and you're taking off the support all of a sudden. That will invariably lead to again hair fall. It can lead to. That is why taper it down and then you can stop it off in certain situations. But as I told, the hormonal imbalance, you need to use it for a long term. So the next question is, what are the side effects if you are using minoxidil? I'll speak about the oral minoxidil and then the topical minoxidil. Oral minoxidil can cause lowering of the blood pressure. So do not take it on your own. We have to do certain investigations like your blood pressure monitoring, your ECGs before we give the oral medication. So it is not recommended to take on your own. The second thing is a topical one, which is the application one. Some people might experience irritation of the scalp. That is due to, sort of allergies. Some people have allergies to deodorants. Like that, some people might have allergies to this kind of minoxidil. The next thing is hair growth on the cheeks. When you are applying a solution on the scalp, it will get absorbed into the blood, it will reach other places, and it can stimulate slightly, hair growth on the other parts of the body as well. For a male, it is not a problem because we already have mustache and beard, doesn't bother us. But in case of females who do not have any hair on the cheeks, it can stimulate the follicles and slightly the hair growth can happen. But that is not a deal breaker. Do not think that using this will cause problem in all of them, or if at all this problem is happening in you, you shouldn't be using it. No, we will guide you how to use it so that the side effect can be avoided.